Okay, hello everyone. Welcome to Being Patient Perspectives. I'm Deborah Kahn, founder of Being Patient. It gives me great pleasure to check in again with Doreen Monks. She was a nurse in neurology who ended up with a diagnosis of early onset Alzheimer's at the age of 62. She's been living with Alzheimer's, and we're here to check in again to see how she's doing. Thanks so much for joining us, Doreen.
And I'm glad to be back. It's nice to see you again.
Okay, so let's talk about a little bit about how you've been in the last couple years. I think the last time we checked in with you was 2022. Tell us a little bit about what you've been up to over the last couple of years.
I'm probably as busy now, or just about as busy as I was when I was working. And working probably as hard as I did then, just in a different venue, I guess. I'm doing well, you know, I bob and weave and tuck and roll with any little glitches that come up. But you learn to compensate for those things because your purpose is beyond that. Your purpose is to live the life you chose, in some respect. Obviously, you didn't choose the diversion, but you can still choose to have a good life, and that's what I've done.
Absolutely. So let's talk a little bit. Before we initiated this live, I was saying how you're not the first person in neurology who's worked in neurology who has ended up with a dementia diagnosis. So tell me a little bit about your job and when those signs first started to present themselves. Did you feel like you knew exactly what it was, or were you like everyone else?
I was in the blue. So I was up until my retirement. I was a neurology nurse for a little over 40 years, and for probably about 35-ish years of those, I was a neuro nurse practitioner. And at the time when I was diagnosed, I was actually the program director for a stroke center here locally. And so my job was obviously to oversee I actually established the program. I tell them I sat in this tiny, teeny wee little office for about 8 minutes and wrote the program. And it's kind of like delivering a baby. So I developed this little baby of mine, and it came into fruition. So the purpose of the focus of the center really was to on hyperacute treatment of acute ischemic stroke or hypertension or hemorrhagic stroke, because we knew that the longer your brain was out without oxygen, the more likely you were going to have damage. So that really was the focus, and encompassed with it was a lot of education, not only to the community, obviously, but to the healthcare staff and physicians, etc., and nurses as well. So it was a sort of a multi-level approach to a particular problem.
Right.
Now, as to diagnosis, I tell everybody the same story. The story, it was a Thursday in March of 2015, actually. So just shy of my 62nd birthday, which is in April. And I got a knock on my door from my medical director, who's obviously a neurologist and my friend. And she knocks on the door. She says, "We have to talk." And she closes the door. And she sits down. And I have all kinds of things rolling around in my head. There's a problem with this, there's a problem with that. I don't know. Somebody did this, somebody did that. And it was none of that. And she said, "I've noticed some things that are happening with you that need to get looked at." And I was like, okay.
So
And
you
she
had
would talk
no,
about
at
things.
that time, you had no
I had
idea.
no clue. Now, retrospectively, it was very clear. But I was having, I was, as the years went on, I was taking more and more administrative work. And quite frankly, I hate paperwork. So it became harder and harder and harder for me to do it. And I kept thinking, what is wrong with you? This is not rocket science. But I was just having a hard time grasping it. And in fact, one year with my evaluation, I got this glowing clinical review and, got sort of blasted on my administrative role, and in fact didn't get a raise that year because I wasn't working up
Okay,
to.
wait, I want to stop you for a second because we hear this over and over again with people who have been diagnosed. That early sign, often those administrative tasks are an early sign.
Right.
The ability to focus and multitask, which one could do prior to symptoms,
Right.
became very, very difficult. And it was oftentimes it's associated as, oh, it must be age. You know, we hear the Post-its a lot. Oh, remind me to do this, that. But
Exactly.
on
Exactly.
the administrative level, we hear that over and over again.
Yeah,
What do you
and
make of that?
I think, it's because of the higher levels of functioning and executive functioning. And that's where problem solving and higher level multitask. I mean, nurses are inherently multitaskers on the clinical area. But, and so, I mean, even to this day, I have no qualms about my clinical skills, quite frankly. I may not be able to document as well as I used to, but I have no, but I think it's because the more complex the act, the harder it is to process, especially as the task becomes newer, you know, um,
But let me
and yes,
let me just
it's
interrupt you for
easy
a
to
second.
push that off.
Because clinical work, you were saying weren't having problems with the clinical work, which one would think is probably a little bit more difficult than administrative, where it's organization and forms and things like that. So tell
But I
me.
think it's because inherently that's what I was. And that's what I did. I mean, I had been working clinically for 40 years. The longer you've done something, it becomes almost what's the word? Less challenging because it's processed deep within you. So it's like recent memory versus distant memory, and I think that's the reason why I wasn't having trouble there. But we chatted, my friend and I, quite a while after that, and she said there were things like, well, first of all, I was like doing some repeating stuff, and then I always tell the story. We had a study coordinator that worked for me, and when you enroll a patient in a clinical trial, you get a little stipend. So she came to me one day and she said, "Do you get the check from so and so?" And I said, "No, not yet." And she came back to me in the week after and she said, "Did you get the check?" I said, "No," and that's very odd. Why don't you check in on and call them and let me know? She comes back that afternoon very sheepishly and said, "Well, not only did we get the check, but you deposited it." Now, on my desk, there was one of those little folder holders, and I had a folder for that study, and I opened it up, and there was the receipt. Now, it never dawned on me to even look at that folder when she asked me. I couldn't connect A to B, and I still, 9 years later, still have no recollection, or 10 years later, have the recollection of that. And so
it's interesting to talk to someone, especially like you, who, I mean, even dealing with stroke patients, we know that stroke can exacerbate symptoms of dementia, right?
yes.
And forgetfulness. So it's interesting to me that you had no clue that something was going on. Did you think the problems with administrative work was just because I'm getting older, or I'm just not
I just thought I was getting dumber. I mean, I just thought I was not able. I lost whatever intelligence I had, or losing it, and couldn't figure it out. It was my fault, not my brain's fault, and it wasn't the work's fault. You know what I mean? Like I couldn't figure out who it was that was responsible for this.
Okay, so for people who haven't met you before, let's talk a little bit about a diagnosis, because as we know, so many people have such a problem getting diagnosed, right?
Oh,
It's not
an
easy thing. It doesn't usually happen right off the bat. It takes months and sometimes years for people to get a diagnosis. Now, you're sitting in a hospital in a neurology department. So tell us a little bit about your experience with diagnosis. Was it like, hey, I need access to the MRI room. Let's run me through the MRI, or how did it work?
It was actually, I immediately, when I talked to my friend, I immediately became pragmatic, and I said, okay, this is something I got to fix, because that's what nurses do. We fix things. That Thursday, I called my primary care physician and I said, I have to see her. I saw her Monday. And I told her what was going on. And she said, well, I'm not a neuropsychologist. She said, this is what you're going to do. You're going to have an MRI to make sure there's nothing structurally going on. And you're going to go see a neuropsychologist. So within 2 weeks, I had an MRI and I had the first neuropsych testing that I'd done. And at that point, so at this point, I'm just 62, I think. No, I was still 61. And I got a diagnosis of some form of dementia, but they weren't quite sure what. It took 13 months later.
Was that based on a
The
cognitive
neuropsych testing, like the neurocognitive testing.
Okay.
It took 13 months later to get the diagnosis of early onset Alzheimer's disease.
Okay, wait. You are sitting inside a neurology department and it took you 13 months to get a diagnosis. Why?
At that point, Alzheimer's was purely a clinical diagnosis. The only way you could diagnose Alzheimer's disease at that point was on autopsy. So there was no test at that point. I finally got diagnosed because I had a different type of PET scan that they do now. It's called an FDG scan, and it measures glucose activity in the brain. Now, the reason I could get that was because years ago, I had a melanoma removed, and the reason it got approved because it was looking to make sure there's no metastasis. So I had that PET scan done on actually April 28th of 2016 at that point. So, and at this point now, I just turned 63. And it was when I had that scan done, the picture showed a pattern consistent with Alzheimer's disease. And that's how I got diagnosed.
Okay. So, what was your, like, I can imagine you're used to taking care of people with neurological problems, not
Yeah.
one. So,
I'll tell you the story, how I got told. I had the PET scan, I'm going to say at 9 o'clock in the morning. And I drove from where I had it to work, which was maybe 10 minutes. As I was pulling into the parking lot, in fact, I remember because it was late, so I had to park across the street. And I got a text message from my neurologist who said, call me. So I called him and he said, call me right back. So I waited in my car.
Is this in the same hospital that you work at? So you know these people? Okay.
Yeah. Yeah. Right. And I work with this particular person on a, rather routine basis. And I call him back and he said, well, it's Alzheimer's and I'll see you, in your next visit, 2 weeks or whatever it was. I can't remember the exact time. And that's how I got diagnosed. Now, and of course you have exceptional access. You're working inside the department, right? Most people's doctors, neurologists wouldn't call them on the phone and say, hey. So here's what I did. So of course I texted my friend, the neurologist, the medical director, and I said, well, it appears to be Alzheimer's. She said, I'll meet you in your office and we'll go over the scan together. And she sat with me and we went over the PET scan so I could see what he was talking about, and which was so much, I'm so grateful for her because at least I can concretely see where the damage was, and then,
do you have any family with Alzheimer's disease? Was this on your
radar? My mother had, I took care of my mother for about 3 or 4 years. She had vascular dementia and her sister had some form of dementia. I think Alzheimer's, but nobody actually told me, but retrospectively, I think that's what it was.
Did you have any risk factors like comorbidities, diabetes? Was that part of?
Well, I was overweight and I had hypertension, which was well controlled. I've had rheumatoid arthritis since I was 35. So there was that whole inflammatory process going on, so that was one of the major ones, I am much healthier at 71 than I was at 60. So, or 62. So,
yeah, that's a lot of the case, right? It's like diagnosis can make you really healthy.
Yes, exactly right.
Tell me a little bit about how you're doing these past 2 years. You're very aware of the brain and symptoms and things like that. How do you feel? Have you noticed? Have you?
I am aware of certain changes. They're probably they're more obvious to me than anybody else.
For example,
I have, I've been told I have I'm quoting here, a superior cognitive store. So my brain has, I guess, enough oomph in it, or
yeah.
a knowledge base in it that has sustained me over these years. It's hard to believe because I talk so much, but I do have some word finding difficulty. I'm easily distracted. I can get easily like I said, distracted and a little discombobulated about things. So getting organized is, I am the note taker. If I lose my iPhone, I'm dead. I tell everybody the blessing to someone with Alzheimer's or dementia is their iPhone, Google, and GPS. So you'll know where you're going, and you'll know what you're supposed to know when you get there. So
What's funny though, is that, for my mom, like a lot of people say that the iPhone can be not like it makes symptoms obvious because the iPhone has so many layers. Like I know with my mom, she used to have an iPhone. She could not use it very early on because all of the apps and going into the app and that was
exactly.
a really hard thing for her. So
I
I'm
think if
surprised
I
you.
started using it then, I would have had more difficult, but at that point it was years. I mean, I think I had an
Right.
iPhone
So
4, I think, or something like that when I first started.
we have a question coming in from Barbara, and she says, unless a family member, fellow worker notices a big cognitive change, what are the chances dementia will be picked up on the traditional wellness exam? Like, for example, remember these 3 words, draw a clock. I think she's referring to like the MOCA test, which is like a very early
Sure.
cognitive assessment, which I'm
Well,
sure you
hopefully
are.
that's done on the wellness exam, which is a little bit of a problem lately,
It's
that
not done.
it's
Yeah.
not done. Working very hard to make that mandatory for anybody over a certain age. And I guess we're trying to decide what that age should be. I personally I think it should be anybody 40 and older. I'm sure that's not going to be the age that they choose. So could it be? Yes, it could be. But if it's not, you have to become that person's strongest advocate and demand further investigation. If you had chest pain, you would expect that the physician would do a certain EKG, and it's normal. They're not going to let it go at that. They're going to do further testing. If there was a possibility you had cancer, the same thing. They would do further investigation to rule in or rule out anything. So you must mandate further investigation. Now, the problem is that most primary care physicians are not equipped to do an extensive preliminary diagnosis. So, but at least they need to pick it up and start the workup. So obviously the goal would be to get to a cognitive neurologist, but you need to get that first part of the workup done, doing blood work, many things, many instances of dementia or dementia-like behavior can come from reversible symptoms, reversible problems. Doing routine blood work, doing an MRI to rule out anything, structural there, and then getting that person to the neurologist. But the key, of course, is for them to own it, for them to say, oh, it's worrying, it's bothering you, it will bother me.
Mhm.
Like my primary care physician absolutely thought there was nothing wrong. But she didn't stop there. She owned
Right.
up to the fact that she wasn't prepared to make any further diagnostic studies in there. So the key is to absolutely demand further investigation.
Yeah, absolutely. I love how you can give us expert advice as well because you wear both hats. Like you were the nurse who was you're familiar with the
Yeah.
whole landscape, and then you have that personal experience as
Yeah.
well.
We're
Um,
working on, there's a bill going to, hope to Congress, hopefully, that is actually going to provide for a free online education for primary care physicians, so they will be better equipped to do that initial evaluation, because, the wait time now for a cognitive neurologist, as we spoke about, is up to 3 years.
Yeah, and
People,
the other thing that makes
that's the
me
problem.
the other thing that makes me really upset is that the gold standard of care is to have a baseline assessment so that you have something to compare it to. So
Right.
something, but there are very, very few doctors out there who will say, let's take the time to give you, you're a healthy person. Let's give you a
It's,
baseline assessment.
it takes maybe 3 minutes. The problem is when you present with symptoms, that disease has been developing
Yeah.
20, maybe 30 years. Now, and this again, I'm being hopeful, but not sure what this will ever happen. But if you start doing baseline testing at 50, let's say, the minute you pick up a glitch, you drop a point or two on the testing, whatever score you use, that's where you start the evaluation. Because when we are now in the golden era of treatment, but for a very select group of people. And that's why an early intervention, certainly early diagnosis, is imperative.
Absolutely. So when you said it really only takes 3 minutes, what type of test are you talking about? I mean,
I'm just talking about a MiniMental status exam. Where you name the president, you spell world backwards, you do math, your serial sevens in your head. Those little tests take a few minutes at the
yeah, but
time.
are those really accurate baselines? Because I mean, if I just
And baseline, see, yeah, they are they certainly are starting point. Are they diagnostic of anything?
yeah,
No, but they measure, these tests are standardized against a certain standard, basically at adult, functional human should test a certain, level, say 30 points. And when you drop to like 28, that's concerning, and again, they're not diagnostic, but that's like to say, you get you every year you get your blood count done, and every year your hemoglobin is somewhere between 12 and 14. And one day you get your blood drawn and it's 10. No physician's going to let that go. They'll at least repeat it. And if it's still low, they'll do further testing to see, is there something causing that? Or do you have anemia? So they wouldn't let it go, even though it's kind of a mild change. Because we know for every, so that's what we're looking for.
right.
What the mini testing does, whichever one you use, it opens the door to investigation.
Right.
It doesn't get you there to the
Right.
diagnosis. It's just the starting point. And I think, again, if we do it on a yearly basis, like checking your blood pressure and, doing an EKG, we'll know the minute you drop, maybe we got to look a little bit into that. Doesn't mean we're going to go doing amyloid PET scans, but it might mean, checking doing further tests, maybe sending you just for neuropsych testing to see if it really is something, and so that's what I mean. It is not, the be all end all of things, but it's at least, like I said, it gets the door open to investigation. At some point, we're going to have a blood test readily available. And they'll do if there's concern.
Yeah. Okay. So I want to know about you. You seem like you are still living a very vibrant life, and doesn't appear that Alzheimer's has slowed you down or stopped you in your track. You're still, very knowledgeable.
There's some things I am, I guess, a persistent person, I guess, or
With a high cognitive reserve, which is important.
I work my way around everything, I don't do things the same way, but I still get them done,
So what does that mean? What does that look like? Give us an example.
For instance, I'm going to say cooking because I love to cook. There are things like off my head I could do. I mean, I cooked them for years. I can't do that anymore necessarily. So I've had to take the time to work through the steps so that I can go ahead and do it.
So meaning before you would not have to refer
no,
to
I wouldn't have to do that.
But now you have to follow a
Like,
recipe.
for instance, this is so silly. My mother, we were very poor growing up, and we ate a lot of chopped meat. And my mother used to make this thing called chopped meat stew. And it's kind of one of those comfort things. And it literally is like boiling chopped meat, throwing potatoes and some canned tomatoes in it. But there's like, I had to write that out so I could trigger the memory again. I make my grandmother's potato salad. I was like this, it was like sent down, handed to me by her. I can't quite get the flavor anymore. I have to make somebody else taste it because I can't, whatever it was in my brain, I can't remember that taste.
Interesting. What does it mean today to you to live with Alzheimer's disease?
I take it as a challenge, along with all the other things I have to deal with. I have multiple comorbidities, unfortunately. They're all being managed. So my feeling, I tell everybody I will have to give in at some point, but I will never give up. So it's something that I bring along with me. I tell everybody I'm a little shorter than I'd like to be, a little wider than I'd like to be. I'm left-handed, I have hazel eyes and I have Alzheimer's disease. And that's how I chose to bring it along. Like I tell everybody, I don't live with Alzheimer's, it lives with me, and it's a part of my life, but it's not who I am. And that's how I look at it.
Are you on any of the new therapies on the?
No, not yet. There's some glitches because of the rheumatoid arthritis. I'm on meds that will preclude you from taking them. So I'm going some other way and some testing and stuff. So I don't know that I'll ever be able to. It's okay.
Yeah.
It's okay.
Well, you
I still
certainly
take my Aricept every day. So
you take your Aricept every day.
oh yeah.
Yeah, well, you certainly do seem like you're functioning very well. And I know that you have a lot of work in advocacy, joining the board of Voices of Alzheimer's. And God knows we need people like you with big brains and, a lot of experience in neurology to understand what's badly needed. So thank you so much for sharing your story with us again, Doreen.
That was great. Thank you.
And let us know how you're doing. It looks like life is good right now, and
It's
we
all
wish you
good.
all the best.
Working hard.
Yes,
Fighting the
absolutely.
good fight, as they say. Fighting the good
Absolutely.
fight.
So
Yeah.
Doreen is an exceptional guest to us because she can give us the kind of expert side of things, being a neurology nurse for so many years, and also what it's like to have a diagnosis. So thank you for sharing your story.
Thank you. Thanks for having me.
And if you've missed any of this interview, don't forget to go to beingpatient.com, sign up for our newsletter. That's when you hear about talks like these. Thanks everyone for joining us, and we'll see you next time.